Hi, welcome to the Fit and Healthy Today show. And this is a continuation of our section on chronic pain. Last week we discussed the causes of chronic pain, which included obviously nightshade vegetables, heavy metal exposure, pesticide chemical exposure, nutrient deficiencies, all those issues. And if you need to, you could review back through our other show, or we have the sheets such as this one at our vitamin and herb stores. But today I wanted to talk about some of the most researched supplements that are available for chronic pain. Now, everything I have listed down here is very well documented, and you could go online and you could look up the research yourself. I've got 2 pages, but I probably could have put about 5 or 6 pages. So I'm probably going to miss some good supplements. Like, for example, I recommend bromelain a lot. It's comes from pineapple, and it's a really good anti-inflammatory. I recommend Serazymes. A lot of athletes use serapeptase enzymes for athletic inflammation. There's a lot more added to this list, and what happens is I know personally when anybody comes into my store, we kind of evaluate where the inflammatory is coming from and kind of appropriately steer people in the right direction with the appropriate research that's for their specific issues. The ones I mentioned here are probably the most popular and, like I said, the most well-studied ones. Number 1, and this is, you cannot fight inflammation or pain without having adequate nutrients, just the basic vitamins and minerals. And that would include a good multivitamin. And I'm not talking about going to your local warehouse, grabbing the big, huge bottle for 10 bucks. And I could list some brands, but I guess I can't do that. With 17 toxic substances in it, and call that your multivitamin. You need a good multiple vitamin high in B vitamins. B vitamins help you kill pain. They also help certain other functions in the body as far as repair and anti-inflammatory. So a good multiple vitamin from a health food store would be my strongest recommendation to you, and you can kind of pick the right one out based upon your stomach sensitivities, or if you want some iron or no iron or food-based. There's a lot of good ones out there, but you're not going to find them in your local supermarket or warehouse. So good multiple vitamin, high in Bs, and if you'd like to, you could supplement along with that. And I've had pharmacists tell this to people for chronic pain: B vitamins, B vitamins, B vitamins. And we know from an athletic standpoint, B vitamins help you metabolize proteins, but they do so many other things. They also actually, if you take them late at night, can keep you awake. So doing a B50 or a B100 in combination with ester C. Now that combination, for some reason, raises a person's ability to deal with pain. That's called a pain threshold. That means how much pain you actually can take. You know, some people have low pain thresholds, some people have high pain thresholds. This combination with the B's and C's raise your pain threshold level to where maybe the pain that was heavy hitting you before won't affect you as much. Basic items used for so many other things. I think that should be number 1 and 2 consideration anytime anybody has any pain and inflammation. Calcium citrate, or bone calcium, it calms down the nervous system, and calcium and other minerals aid the body in alkalizing. Now, remember, we've got acids and we've got alkalines, and most of the time I tell you, eat an alkaline diet. And I think in the series before this, we talked about the diet, the macrobiotic diet, things that alkali the blood. When you alkali the blood, pain drops. So it's necessary to have good quality, and I'm not talking about the limestone at your nearest drugstore called calcium carbonate. Has a poor absorption, and yes, it'll neutralize pH, but there's so much free-floating calcium going to your kidneys and into your joints that will cause you problems further down the road, including digestive issues. So go with a good calcium citrate or a bone calcium source, and mind you, you're going to usually find those once again in a good health food store, in combination with magnesium citrate. Now, we talked about how the average American only gets about 40% of their magnesium needs from their foods now. So that being the case, obviously in this country, because our vegetables are so mineral deficient, we need to have more magnesium. It stops muscle cramping, literally can stop pains of old surgeries. I have had, and I I've had this happen with my customers before, but to read it coming out of some of the university studies on old football injuries from some of these old football players, adding the magnesium in there with the bone spurring that's occurring and the muscle spasms actually can help with old sports injuries. Accidents, arthritis. Now, when your doctor, once again, does your magnesium analysis, he should do a full mineral analysis to make sure that you've got adequate amount of minerals. Because another category in here I would say is trace minerals, and hopefully in your good multivitamin you're getting the additional other minerals such as zinc, copper. Those are all necessary for deflaming and having less pain. D-L-phenylalanine. If there was a magic pill. It raises endorphin levels. Now, endorphin levels are your feel-good hormones that make you all happy, and you usually have them when good things happen in your life or you're a joyful person in that regard as well, too. But exercise also increases endorphin levels. It's a certain neurotransmitter that you release, and it just makes you feel so good. D-L-phenylalanine raises endorphin levels in a natural way. So, I mean, I've used this actually to help get people off of their pain medications because it raises endorphin levels. The pain medications knock off the body's own natural ability to kill off pain, whereas D-L-phenylalanine raises endorphin levels. So this is one way that you can utilize to help in conjunction with your healthcare professional to get you off some of those pain medications. Green lipid sea mussel, and you're probably going, yuck, what is green lipid sea mussel? It does come in a supplement. You don't have to sit there and go look for green lipid sea mussels. But what was interesting about it in the clinical data I came out with, or the studies supported, is it was more effective than ibuprofen. Wow, most doctors are saying, passing out and saying, do your ibuprofen 2-3 times a day. The reason why, and I've got the good explanation down here, it modulates abnormal cell membrane chemistry of pain and inflammation without damaging the digestive tract. And I think, bottom line, since we know that the NSAIDs damage the digestive tract, oh my. Okay, that being the case, you know, you end up with that leaky gut and toxins leaking into the body, chemicals leaking, and you end up with more pain. The NSAIDs just cause this magical cycle to occur of chronic pain and inflammation, whereas something like green lipid sea mussel doesn't do that. Acetylmethylstearate, I never say this right. We call it CMO, actually. And CMO really has a lot of research pertaining to autoimmune and arthritic conditions. Man, the studies that were done on here showed that it was effective in 50% of people for reducing pain that had arthritic, rheumatoid arthritis, and autoimmune actually induced types of arthritis, including, like I said, rheumatoid arthritis. It comes from beef, and you have to kind of know your source of it. There are some vegetarian sources as well. They're not quite as effective. But it kind of lubricates the joints, and as noted in here, it literally does help support membranes. Some good studies out on CMO. You can look that up online. Niacinamide and acetylcysteine. We call it NAC, is what we call it. Might help if I spelled it right, too. I've got the dosages down on here. We've got 500 milligrams and 200 milligrams twice a day, preferably on an empty stomach. What it does is it aids and abets the detoxification of the body and free radicals that cause pain. And so as you have these free radicals that are causing oxidation and rust in the body, these are niacinamide in a combination with one of the strongest antioxidants known to man, NAC, N-acetylcysteine, substantially reduces the toxin level, and you can throw it out. Niacinamide also has some research on arthritis, which we know, obviously, because of this, and research on Alzheimer's, too. It doesn't cause any flushing, unlike the niacins that sometimes the doctors recommend for cholesterol. Glucosamine chondroitin sulfate. Now, this has recently, for some reason, come under dispute in a lot of commercials, and they're trying to say things are better than glucosamine chondroitin sulfate. And I have to say, there are so many studies that back up this supplement, animal research and human research, because it's been around for a long time. And there were actually graphs scientific graphs that I came across that literally showed 1,500 milligrams, 1,200 milligrams helped rebuild bone, not just cartilage, bone as well, and cartilage tissues for arthritic people. In about 2 to 4 months, you notice a big difference and a reduction in pain. Whereas the NSAIDs, after 2 to 3 months, their inability to kill off pain and reduce inflammation dwindled. So it was like, here we had this, high up, and then all of a sudden you watch it, and the glucosamine and chondroitin sulfate zoom up, and the NSAIDs go down. So the only thing is, you have to get, if you have diabetes, you have to get special sources of glucosamine. There's one source called N-acetylglucosamine that does not affect blood sugars. I think that, I know we have a local doctor in town, Dr. Lindberg, and that's what he'll put his patients on as well. There is a product called hyaluronic acid as well, and you need to have a fermented source that can lubricate joints. I'm fairly young, and so I don't have any cartilage deterioration, but sometimes we can get a stiffening of the cartilage, and so when the cartilage stiffens, adding a little bit of glucosamine with maybe some of the hyaluronic acid, which is very youthful and all, but it helps with connective tissue, and it pulls moisture into the joints, into the skin, and other places. A lot of anti-aging treatments for the skin with hyaluronic acid too. Probably the most studied herbs that I came across were boswellia and turmeric. And once again, I know Dr. Lindberg occasionally will recommend putting his patients when they don't want to do the NSAIDs, because a lot of them, like I said, upset your stomach. These are very potent anti-inflammatories and painkillers that have been around for centuries. So they're time-tested versus showing heart valve deterioration and all of that we see with NSAIDs, gut, all those issues. You're not going to find that with boswellia or turmeric. In addition, they're extremely anti-cancer. They're potent antioxidants. So usually when you take turmeric, you're going to take it a little bit with food because it's a spice. It's a turmeric. We use it in food. And so yeah, I usually do it with a little bit of food. Type 2 chicken collagen. A lot of recent studies have come out about that. And some of the best studies that I found were done on children, particularly children with rheumatoid arthritis. We've seen a real influx of rheumatoid arthritis recently in kids, and we don't know if it's being caused by the vaccines, diet changes, chemicals in the environment. It's probably poor diet. I think it's a combination of all of the above. So the type 2 chicken collagen literally stops the body from attacking itself. And so it's very helpful not only in regular arthritis, but in autoimmune-induced arthritis, such as rheumatoid arthritis. So for reduction of pain, and in the kids that they studied that had the rheumatoid, 80% of the kids had a reduction in pain and swelling just after 3 months worth of usage. That's a pretty substantial figure for an item that's less than $25 a month for a good dosage. So helpful consideration, particularly for children, I think. And I know, once again, this is something on a Dr. Lindberg list we see sometimes coming in. And some other physicians, too, are recommending the type 2 I'm seeing coming in because the research is just so there. I think there was a recent study of it replacing some of the very hard-hitting drugs, methotrexate, for rheumatoid arthritis, that it competed with it and was more successful than methotrexate. So if you've got rheumatoid arthritis, you'll know what I'm saying when I give that name. MSM. Necessary for the building blocks of collagen, and that is our skin, our joints, our tendons and ligaments. And so it's a sulfur compound, so if you've got a sulfa drug sensitivity, it might be something you have to pursue with very carefully on a low dosage. But what it basically does is it promotes the detoxification of the body, particularly heavy metals. And then it's a sulfur compound. Sometimes we forget to look at the periodic table, and yes, you're hearing about it again, your high school chemistry. These different types of